What is GERD? Gastroesophageal reflux disease, GERD, is a digestive disorder that's referred to as pediatric GERD when it affects young people. Nearly 10% of teens and preteens in the United States are affected by GERD according to GI Kids. GERD can be difficult to diagnose in children. How can parents tell the difference between a little indigestion or the flu and GERD? What does treatment involve for young people with GERD? What's up, fellow human? I'm Joshua, and this is the Stomach Health Channel, where I'm going to discuss different facts, remedies, and such about your gut. Now, let's get on with the video. What is pediatric GERD? GERD occurs when stomach acid backs up into the esophagus during or after a meal and causes pain or other symptoms. The esophagus is the tube that connects the mouth to the stomach. The valve at the bottom of the esophagus opens to let food down and closes to stop acid from coming up. When this valve opens or closes at the wrong time, this may cause symptoms of GERD. When a baby spits up or vomits, they're likely displaying gastroesophageal reflux, GERD, which is considered common in infants and usually doesn't cause other symptoms. In infants, GERD is a less common, more serious form of spitting up. Children and adolescents may be diagnosed with GERD if they show symptoms and experience other complications. Symptoms of pediatric GERD. The symptoms of childhood GERD are more serious than the occasional stomachache or infrequent active spitting up. According to the Mayo Clinic, GERD may be present in infants and preschool children at there. Refusing to eat or not gaining any weight. Experiencing breathing difficulties. Starting with vomiting at 6 months of age or older. Fussy or having pain after eating. What would you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. GERD may be present in older children and adolescents if they have pain or burning in the upper chest, which is called heartburn, have pain or discomfort when swallowing, frequently cough, wheeze, or have hoarseness, have excessive belching, have frequent nausea, taste stomach acid in the throat, feel like food gets stuck in their throat, have pain that's worse when lying down. Long-term bathing of the esophageal lining with stomach acid can lead to the precancerous condition Barrett's esophagus. It can even lead to cancer of the esophagus if the disease isn't effectively controlled, though this is rare in children. What causes pediatric GERD? Researchers aren't always exactly sure what causes GERD in young people. According to Cedars-Sinai, several factors may be involved, including how long the esophagus is inside the abdomen, the angle of his, which is the angle where the stomach and esophagus meet, the condition of the muscles at the esophagus's lower end, pinching of the fibers of the diaphragm. Some children may also have weak valves that are particularly sensitive to certain foods and beverages or inflammation in the esophagus that's causing the problem. How is pediatric GERD treated? Treatment for pediatric GERD depends on the severity of the condition. Doctors will almost always advise parents, children, and teens to start with simple lifestyle changes. For example, eat smaller meals more often and avoid eating 2 to 3 hours before bedtime. Lose weight if necessary. Avoid spicy foods, high-fat foods, and acidic fruits and vegetables, which can irritate your stomach. Avoid carbonated beverages, alcohol, and tobacco smoke. Elevate the head during sleep. Avoid eating large meals before vigorous activities, sports games, or during times of stress. Avoid wearing tight-fitting clothes. Your child's doctor may recommend medications that help reduce the amount of acid their stomach produces. These medications include antacids, histamine, 2 blockers that reduce acid in the stomach, such as Pepcid, proton pump inhibitors that block acid, such as Nexium, Prilosec, and Prevacid. There's some debate regarding starting young children on these medications. It's not yet known what the long-term effects of these medications may be. You may want to focus on helping your child make lifestyle modifications. You may also want your child to try herbal remedies. Some parents feel that herbal remedies may be helpful, but the effectiveness of remedies is unproven, and the long-term consequences for children taking them are unknown. Doctors rarely consider surgery as a treatment for pediatric GERD. They generally reserve it for treating cases in which they can't control serious complications, such as esophageal bleeding or ulcers. It's extremely painful on your chest when you have acid reflux. You just want to make it go away. What if I told you you could make it disappear into oblivion without making your throat hurt? Eating the medicine like a candy? Well, this is what Pepcid does. Chewable mint-flavored candy like medicine. that would make your acid reflux pain disappear for a whole day. Don't just take my word for it. Look at these 3,000 5-star rating. It's also important to remind you that I'm in no way sponsored by Pepcid. It's just a great brand that I found on Amazon to be an affiliate. This means that if you'd like to buy Pepcid, clicking on my link in the description would help me massively because I would be receiving a commission for each purchase. What do you think about these information? Do you think it's useful? If it is, support this channel by giving it a like and subscribe. And also don't forget to click the notification bell for more interesting facts like these.